Yeah. Hello, Soundarya. Soundarya.
Oh, sorry. Hi. Hi, guys.
Hi, ma'am.
How are you all?
Fine, ma'am.
Can you hear me right?
Yes, ma'am, audible.
Yeah. How was the exam?
Okay, ma'am. Good.
Nice. We can discuss the question paper, okay? Deepanjana,
Yes, ma'am.
can you read first question?
Okay, ma'am, just a minute. Mrs. Fraser had a temporary ventricular pacemaker placed at the start of procedure. This temporary system was used to support during the procedure only. How should you report temporary system?
Okay, which one is correct option?
Ma'am, 33210 is the correct.
Option A.
Yes, ma'am.
Yes. Okay. Here, first thing you have to see which pacemaker placed. So temporary or
Yes.
permanent. In this question, temporary ventricular pacemaker placed. So 33210 is for insertion or replacement of temporary transvenous single chamber. And 33211 is for hello.
Ma'am, just a second, just open book, ma'am.
Ramya, you open book, right?
Yes, ma'am.
ಅಲ್ಲಿ
To code double chamber.
Okay.
Or they directly mention double chamber or dual chamber.
Atricular, ventricular means dual. We can have
Dual chamber, yes. Understood, right? And second question, Ramya.
Mr. Azeri, a 68-year-old patient, has a dual chamber pacemaker. The lead in the system were recalled. The leads were extracted via transvenous technique. The generator was left in place. And new leads were inserted via transvenous technique. How would you report this procedure?
Okay, which one is correct
I,
option?
I have marked option D.
Okay.
332354.
So,
Removal of pacemaker electrode dual leg system.
is correct. Here, second question. Two procedure is completed.
Yes,
One
so
is
51 for my
51 modifier for two procedure. That is
two procedure at a time.
yeah. One is dual chamber pacemakers, and the dual chamber pacemaker was removed and inserted new one.
It is 217.
So 33214 is go for
Injection transducer electrode
this is
placement
conversion,
pacemaker.
right? So
Sorry.
this code hello.
Yes, ma'am. What you
Yeah.
see?
This code goes for conversion like single chamber to dual chamber, right? But in question, they specifically mention dual chamber is removed and new lead was added, inserted.
Okay.
So 33214 is incorrect. 33215 for
Repositioning of previously implanted transducers.
yeah.
Yeah, change
This
the
also
position.
yeah changing the position. So this also incorrect.
Okay.
33208 for
No, sorry, double three. Insertion of new or replacement of permanent pacemaker with a transvenous electrode, arterial and ventricular.
Yeah. So this is also wrong answer. So final one is C. Double 3, 4, 3, 5. Direct questions, right? Second one.
Yes.
Sanjana.
A 35 years old patient with a venous catheter require a blood sample for hematology testing. The sample is collected by her PICC catheter. How should we report? So I'm giving a BMAP 36590. So here clearly mentioned for blood sample for hematology by PICC method.
Yes. Because blood sample is collected with PICC. PICC means
Yes.
peripheral of central venous
Catheter venom.
catheter.
Catheter venom. Ma'am, excuse me, ma'am, my background noise is too much.
Yeah. I think, yes, Deepanjana.
Okay. No, it's
Wait, 1 second. Third question, the blood sample is
Sunil,
collected
hello?
with PICC. PICC means
सुनिए मैं
peripheral level
एमसीसी इंस्टीट्यूट से
central
बात कर
venous
रहा हूँ
catheter.
okay.
So,
एमसीसी इंस्टीट्यूट से बात कर रहा
364,154 blood sample is collected with venipuncture, right?
Vein punch. Yes,
yeah.
blood collection they will do.
Yeah, this one is wrong option. 36591 is for
36591 is collection of blood specimen from a completely implantable venous access device.
yes. Because in question they directly given PICC catheter.
No.
The blood sample is collected with PICC catheter. So it is peripherally catheter.
Okay.
Option B is correct. Fourth one.
A patient underwent a secondary percutaneous transluminal thrombectomy for retrieval of a short segment of embolus evident during another percutaneous intervention procedure. How would you report this secondary procedure?
So which one is correct option?
I have marked B, ma'am.
B,
ma'am. 37,186 with additional primary cost.
This one is direct question. So no need to worry. Right. Because 364,154 and 36591 is sorry.
37,184.
37184 and 37185 for primary, right?
Primary. Yes.
And 37187 also primary, I think so.
3718. Actually, 3718 is an add-on code.
Yeah. Right.
In addition, they have done some primary procedure.
Yes. Add-on code. Percutaneous transluminal mechanical thrombectomy vein.
Yes. Okay.
37187. This is totally different from our procedure. So option B is correct answer.
Okay.
Fifth one.
The patient is a 67-year-old gentleman with metastatic colon cancer, recently operated on for brain metastasis. Now for placement of an infused A port for continued chemotherapy, the left subclavian vein was placed with a needle and guide wire. This was confirmed to be in proper position fluoroscopically. A transverse incision was made just inferior to this and a subcutaneous pocket created just inferior to this. After tunneling, the introducer was placed over the guide wire and the power port line was placed with the introducer and the introducer was peeled away. The tip was placed in the appropriate position under fluoroscopic guidance, and the catheter trimmed to the appropriate length and secured to the power port device. The locking mechanism was fully engaged. The port was placed in the subcutaneous pocket, and everything sat very nicely fluoroscopically. It was secured to the underlying soft tissue with 206 stitch. What code should be used for this procedure? I have marked C. 3661.
See, ma'am, I'm just see, ma'am. Eliminated by this. I am option B and D eliminated by Modifier, ma'am. 26 modifier for service used for radiology and pathology and cardiology procedure, and 36 561 for 36 561 for the incision tunnel centrally insert central venous uh, for 67 years old, ma'am.
Yes,
And
correct.
77 no, I'm this 7700, this code I'm checked by Google, ma'am, because I don't have Epics.
No, it's not Epics.
Not epics.
It's radiology.
70,000 series radiology part.
Okay, sorry, ma'am. Check by Google, ma'am. So this code.
Okay. In fifth question, the patient is now for infuse a port to continue chemotherapy, and also after tunneling, the introducer was placed. In the question itself, they mentioned tunneled or non-tunneled, right?
Yes,
So 36556 is cancelled because this one is non-tunneled.
yes,
The provider particularly mentioned it is a tunneled and port. 36558 is removed for without subcutaneous port or pump. But in question, they mention port for continued chemotherapy, right? So
Yes.
correct option is 36561. Insertion of tunneled central inserted central venous access device with subcutaneous port.
So option C is correct, Mama.
Yes, option C is correct. Sixth one.
The patient is a 59-year-old white male who underwent carotid endarterectomy for symptomatic left carotid stenosis a year ago. A carotid CT angiogram showed a recurrent 90% left internal carotid artery stenosis extending into the common carotid artery. He is taken to the operating room for a redo left carotid endarterectomy. Left neck was prepped and the previous incision was carefully reopened. Using sharp dissection, the common carotid artery and its branches were dissected free. The patient was systemically herpenized, and after a few minutes, clamps applied to the common carotid artery and its branches. The longitudinal arteriotomy was done with extensive layering of intimal hyperlepsia with no evidence of recurrent atherosclerosis. Yes, yes, elastic balloon tip stent was inserted first proximally and then distally with restoration of flow. Several layers of intima were removed and endotectomized surface irrigated with a herpes saline and oval Dacron patch was then sewn into the paste with running 60 proline, which CPT should be used.
Okay. In this question, the patient previously
option.
completed. Wait 1 second. I'll explain. Okay, this question
Okay.
in short way. Here, doctor is previously completed endarterectomy procedure for carotid stenosis, right? Again, patient diagnosed with same diagnosis, carotid artery stenosis at the same site.
Hmm.
So, which one is correct option?
Option B, ma'am.
B,
Option
ma'am.
B.
Combo
Option B or D?
mark B. B.
B.
B, ma'am. 35301 for thrombectomy, including patch growth. If performed cathode and vertebral subcubial by neck incision.
That
Yeah,
35.
35301.
Yes, that's why
Which location
35301.
mentioned in the
Uh, 3, that is carotid.
yes,
Here.
carotid artery?
Uh,
Carotid location is mentioned in the question.
yes. 35311 is subclavian. I think subclavian
Yes,
thoracic incision.
subclavian.
And 35390 for the reopened catheter thrombectomy more than 1 month ago.
Yes, that is the add-on code for the reoperating for the same
Reopened.
disease at the same site.
Yes, ma'am. A catheter is placed in the. Ma'am, can I read for 7?
Yes, continue.
A catheter is placed in the left common femoral artery in the retrograde fashion, which is directed into the right iliac system, advising it to the external iliac. Dye was injected and selected right lower extremity angiogram was performed, which revealed patency of the common femoral and the profound femoris. The catheter was manipulated into the femoral artery, in which the select lower extremity angiogram was performed with revealed occlusion from the polylateral and the femoral artery. What are the procedure code for this service? Ma'am, 26th I am giving for the radiology pathology for this.
Okay. Explain
And
why you use 26 modifier. Explain in detail.
okay,
Why you use 26 modifier?
because from here angiogram is happened, na, so angiogram is a radiology. That's why,
It's
ma'am.
radiology, but 26 modifier not only because of radiology.
Professional component.
Wait,
Professional components also, ma'am.
here, actually, radiology or lab report done by technician, right? But 26 modifier is with the doctor or provider or surgeon personally reviewing or interpreting or building the imaging guideline or lab report. Physician itself reviewing labs and surgeries. Okay. Did you understand?
Yes, ma'am.
When we will give 26 modifier?
Ma'am,
Not only
when
because of
When
not
the
only because
physician,
of yes, tell me.
when the physician or any healthcare
Any
professional
healthcare provider
will review the
reviewed or interpreting lab
interpretation
reports.
reports. Okay.
Personally reviewed or interpreting lab report
But here,
before lab technician.
they didn't mention anything, but all the options had 26. So
26, right?
we can.
If they mention lab technician is done in lab report, then you can't code 26 modifier.
Okay.
Okay, understood, right?
Yes, ma'am.
yes, ma'am.
Next, okay, 75710 and 75716.
75710.
Okay,
Uh,
how you will differentiate it?
CT angiogram.
CT angiogram, gave D options, right?
Yes, ma'am. Unilateral extremity angiogram, ma'am.
The 710 is for extremity. 716 is for unilateral. Oh, sorry, unilateral extremity.
Both are belongs to extremity only.
But the here,
One is unilateral, one is bilateral.
uh, but
How
here
you?
the left common femoral artery.
Yes, they mentioned left or right.
Left was directly into the
Right, right,
Right.
right lower extremity, ma'am.
Yes, they mentioned only one laterality of side, right side. So
And
correct option is
36 to 47 for initial third order and more selective abdomen, pelvic, and lower extremity within the vascular family.
which one?
Here they have performed left, no ma'am, left common femoral artery. Okay, unilateral.
No, no. Select right lower extremity angiogram was performed and revealed patency of the common femoral and
It's injected. Okay, okay.
open femoris.
But the catheter is placed in the left common
Left, yeah.
femoral. Okay.
Catheter is placed on left.
Okay. Okay.
Okay, let's move to eighth one. Did you understood right when you will give 26 modifier?
Yes, ma'am. Professional.
Provider itself reviewing or interpreting the lab report without lab technician. When lab technician is involved, then you can't take 26 modifier.
Okay. So shall we move on to eighth question?
Yes, wait.
Preoperative diagnosis left breast carcinoma, postoperative diagnosis left breast carcinoma. Name of the procedure: left lumpectomy and sentinel node biopsy. Description of procedure: the patient is a 65-year-old female admitted with a diagnosis of left breast carcinoma. Risk and benefits of the procedure were discussed preoperatively, including risk of bleeding, infection, deformity in the breast, chronic pain, numbness, chronic lymphedema associated with the lymph node biopsy, and other complications. The patient agreed to proceed because the wire was in the outer quadrant of the breast over the lesion, and the length of the wire was 10 centimeters. It was felt that it would be best to approach the node biopsy as well as the lumpectomy through the same incision in the outer quadrant of the left breast. Incision was made with 15-inch blade through skin and subcutaneous. Some hemostasis was achieved with bioelectrocautery. Flaps were formed in usual manner. A wire was brought out through the incision. We then circumferentially removed all the tissue around the wire down to the tip. We marked the specimen with long lateral stitch, short superior stitch, two lateral clips, and one superior clip. We were able to identify a hot node in the axilla and at least two lymph nodes that were blue dyed within sentinel nodes. We did perform lymph scintigraphy and injected 2 cc of methylene blue dye in the periareolar area preoperatively and massaged the breast for 5 minutes. The lymph nodes were excised and the biopsy was performed on the axillary node. At this point, we copiously irrigated the area to assure good hemostasis. We placed clips throughout the entire cavity. We then closed the deep dermal tissue with interrupted 3-0 vicryl sutures and then closed the skin with fine 5-0 nylon. The patient tolerated the procedure when the sponge count was correct. Blood loss was minimal. The patient was sent to the recovery room in stable condition. What are the codes for this procedure?
Okay, which one is
I have
correct option?
B, ma'am.
C. Okay, then tell me 52 and 51 modifier why you used.
Ma'am, 52 modifier for use the initial, the 50, sorry, first we have to come to 51. 51, ma'am, used for the indicate the multiple procedure where perform the same physician
Which
provider
procedures?
during multiple procedure for it.
Procedure name.
Like ma'am here,
In this question, the two procedure is done right.
Yes, ma'am.
yes ma'am,
The two procedure name.
it's the
Doctor done two procedure.
yes, lymph
That is
node biopsy.
node biopsy one. Next one.
So 387.
You gave 52 modifier for multiple procedure. So, and you both got right options. So you have to tell 51 and 52 modifier. Have you took and have you used? Have you applied for this question?
I didn't
51
see
and-
Ma'am,
modifier.
another one left.
I have I didn't see modifier. I just randomly
Okay.
did only
Yeah.
just go through the codes alone. I didn't see the modifier.
Okay. Provider here.
Ma'am, I'm
Provider.
eliminated by modifier, ma'am.
Okay. Then tell me the Anjana.
Yes, ma'am. Actually, ma'am, first one is needle biopsies happened for this,
Okay.
and second one is that this one, the breast incision. Left breast
Lumpectomy.
incision was by
Breast
15.
removal.
Yes, ma'am.
Yes.
So
The
two
two
procedure
procedure
is
is done.
before.
Oh yeah.
Yes. So that's why I am giving my option B because I did not see any observe anything. Here is 2 and 51. One procedure is reduced initially by doctor, because the doctor told that hematology, there are much of hematosis, but nothing is happened. That good hematosis is happened. So that's why that procedure is reduced.
Yes. And also,
That's
Sorry, I didn't get for
wait,
52.
wait. 52 modifier used for, while explaining code, I will tell, okay. For B option is correct, okay.
Hmm.
193014 lumpectomy.
Yes.
Mastectomy course, and it is mentioned in lumpectomy. So specified form is
30.
19301 for lumpectomy. But 302 is given for specified form axillary lymphadenectomy means, I think so.
301.
Yes, with axillary lymphadenectomy. But in this question only mention lumpectomy, left lumpectomy. So you have to give 193014.
Okay.
You can eliminate C option.
Yes.
And 19120 is for
19120. Excision of cyst.
excision of cyst.
Fibroadenoma.
There is
Yes. So here it's not the.
already provider removed breast, right? So
Hmm.
any excision or any fibrosis is not done in this procedure. And 38525 is for
38525 is for a biopsy or excision of lymph nodes, open deep axillary nodes.
yes 38525 after they given 52 modifier, right?
Hmm.
But here in this question, provider mentioned only. Wait one here provider only done sentinel node biopsy, right?
This one.
Sentinel node biopsy means the small portion or one or two nodes are removed. It's not completely, but in the description they mention deep. What's the code? One second. Which question?
Eighth one. Actually, left breast was removed.
Yes, left breast was
yes, yes.
removed. Lumpectomy means removal of one side of breast. 358 35 sorry 38525. 38525 means biopsy
Open
of
to
excision of lymph node with open deep axillary node. Deep means complete removal of axillary node. But in question, the provider mentioned only senatal node biopsy. Senatal means some small portion or one or two nodes removal. So their procedure is not completely removed.
Okay, okay,
That's why 51, 52 modifier, reduced procedure.
okay.
So here that's why 38525 after 52 modifier used for reduced procedure.
Okay.
Understood?
Yes, ma'am.
In description, deep axillary node is removed, but in the question only
Sentinel.
small portion of biopsy is performed. That's why the 52 modifier is used. Understood, Deepanjana?
Yes, ma'am.
Then after 38792 is for
Injection procedure, radioactive tracer for identification of sentinel node. Here they have injected methylene do something.
yes, understood. 20 cc of methylene blue dye.
Hmm.
They use for the procedure, this injection. That's why they they use 38792, and for whole procedure they use 51 modifier.
Multiple procedure.
Multiple procedure.
Yes, multiple person.
Understood?
Yes, ma'am.
Yes, ma'am.
Next, ninth one.
A patient had a temporary transvenous pacemaker system instead with electrodes placed in the right atrial and ventricle chamber. How should we report? So, ma'am, this is direct question. So,
Direct
three,
question.
two, three,
Double
three,
Three
three
two
two.
double.
that is insertion of or replacement of temporary transvenous dual chamber pacing electrode.
Yes,
Next, 10th one.
Marvin, a 51-year-old patient, required a conversion of single chamber pacemaker system to a dual chamber system. Previously placed electrode was removed transvenously. Skin pocket was open and the pulse generator removed. The skin pocket was then relocated and a dual system was placed with transvenous electrode in both the right atrial and ventricular chamber. The system was tested and the new skin pocket was then closed. The patient tolerated the procedure well. How should you report this service?
Okay, here two procedure is done. Which procedures? Two.
I have marked C, but it is wrong.
Yeah. It is
ma'am, I
wrong
marked
option.
D. No, it is right, ma'am, because I'm giving D because ma'am, I'm going for that. I'm check for 33214. 33214. I'm checking because
Trade of implanted pacemaker system, conversion of single chamber system to dual. Yes, this is the correct.
Double 3208 is for new or replacement. Sorry. Insertion on new or replacement of permanent pacemaker. So in this question, they directly mention conversion of single chamber to dual chamber.
dual chamber. So,
Conversion.
ma'am, upgrade option. So that's why I'm going for 33214, ma'am. I did not check anything, ma'am. Just check first option.
Right. Correct. 51 modifier for two procedure. First one is the conversion of single chamber to dual chamber system, and second one is the skin pocket was removed and relocated
Relocate.
skin pocket. Yes.
Okay.
For that two procedure, you have to take 51 modifier.
Yes.
Double 3322 is for pocket relocation.
Here, come on doubt.
Yes.
Why we cannot give 51 modifier for 33214?
No. After two course, they given 51, right? For whole procedure they mentioned, not for particular code.
Go for
Here after three wait in eighth question, after 38525 they given 52 modifier because the code description itself reduced, right?
okay.
In code description they mention whole thing, deep axillary lymph node biopsy, but in provider it's not completed for whole deep axillary node. That's why they given 52 modifier after 38525.
Oh,
This 51 modifier belongs to whole procedure for both code.
okay.
That's why they given last.
Okay.
11th one.
A patient require a battery change for a single chamber pacing cardioverter defibrillator system. The battery was taken out in the subcutaneous patient. The new battery was placed. The cardioverter defibrillator was then reattached to the electrodes, which were intact and tested, and the skin pocket was then closed. How should these services be reported? Option
Ma'am,
D.
this one I'm wrong, ma'am. Actually, I'm giving option B, ma'am.
Why?
Because ma'am, 33241, the removal of implement derivation plus generate only, ma'am.
Double 3241.
Yes, ma'am.
Wait 1 second.
And 33240, ma'am. Instant of implement derivative plus generator only exciting single lead.
But in the question, removed and reattached, right?
Yes, ma'am.
But 33241 is only for removal. for implantable defibrillation. But in the question, removed and reattached the electrode.
Okay, ma'am.
First patient came for procedure for battery changes for single chamber. The battery was removed and new one is placed and reattached to the electrode. Clearly given in question only.
Okay, sorry, ma'am.
So 33214 is for removal only. So it's not reattached. And check codes double
Removal of implantable.
double three two double four and 33262 and 33241. 33241 is only for removal implantable. 33236 for
Removal with replacement.
removal and
Replacement.
replacement. 33244 for 2 that's for removal of single or dual chamber by transvenous extraction.
Sorry to interrupt. Which one is the correct answer for 11th one?
D. Option D.
B, right?
Yes.
Ma'am, 33262 code is out of numerical sequence.
3.
Yes, ma'am. This day in my book it is showing a code is out of numerical sequence C3326.
Which code?
Before,
3.
yeah, it is before the page, like before you turn the page, Dipanjana, it is there. Like one page before you turn, it is there.
Which year book you are using? CPT?
I am using 2025, ma'am.
25 okay.
Double three. Ma'am, can you share the ma'am, can you share the page number?
Mine is 2021 CPT book. It's in page number 248. Actually,
Totally
before
different.
that page, before you just turn the page, previous page is there.
262. Yes, 262 is there.
What, Dipanjana?
Yes, it's the remover for implement derivative generate with replacement single loop system. Got it.
In question, they directly mentioned the removed and replaced.
Yes, ma'am.
So you gave 33241 only removal of implantable. Direct question based on that.
Okay, ma'am.
You can't miss
Can you
the
go for
direct
12
question answers. Okay. Let's move to 12th one.
The patient had an endarkectomy during the same surgical session for a repair to a coronary arteriovenous chamber fistula. The fistula repair did not require cardiopulmonary bypass to complete the procedure. How should this service be reported?
Which one is correct option?
I have marked A, but it's wrong.
Ma'am, I'm giving ma'am
Can you
C. It's
explain?
correct.
C. Dipanjana.
Ma'am, I'm giving C. Ma'am, C is correct because ma'am,
Okay.
repair coronary arterio antivirus cardiac chamber fistula with 3351 with the cardiopulmonary bypass. But ma'am, 3051 without cardiopulmonary bypass, ma'am. So
Okay,
that's
Ramaya, explain why did you give A option?
335721. Coronary endarterectomy open any method left anterior descending circumference. I have 33501 I have selected and 3357 to add on code also I have this one for the endarterectomy. I think for that I have taken the procedure.
Okay.
Patient had
572.
coronary endarterectomy open any method. I selected that code. A patient had an endarterectomy during the same surgical session for a repair of coronary artery venous chamber fistula. So I have taken that code and along with
So
that.
this procedure is totally different. The coronary endarterectomy open or any method of left anterior descending.
Okay.
But here, while during endarterectomy procedure, repair coronary artery venous chamber fistula also done, repaired. So correct option is C, 33501.
Okay.
Ma'am, 13-1. Can you?
Because it's okay that you gave 33501 also right. No, option A.
Correct option is C, no, ma'am. 12th one.
C option answer. 13th one.
What code should you report for a carnival approach of medistectomy with exploration, drainage, removal of foreign body or biopsy? Ma'am, I am giving 39000 because ma'am here clearly mentioned medistectomy with exploration, drainage, removal of foreign body or biopsy.
Even
That
I have also marked B.
E or B.
B.
B B B.
B for ball.
Which locations they mentioned in this question provider?
Yeah.
Here,
Cervical approach.
biopsy.
Correct one is cervical approach.
Yeah.
Cervical
Direct
approach.
question. Direct question.
Yes,
Right.
ma'am. So
But
I am giving B.
answer shows A.
Option is A.
How?
Option is A. Ramya,
Yes,
you
ma'am.
giving option A.
No, I have given B, but it answer shows A.
No, that's wrong. Answer is option B.
B only. Okay, then it is correct for me.
39000.
Then I
Yes,
Direct
ma'am.
question.
It's also correct for me. Added 1 mark.
14th one.
Roger had rhinoplasty to correct damage to a broken nose. 1 year later, he had a secondary rhinoplasty with major revision. At the end of the second surgery, the incisions were closed with a single layer. How would you report the second procedure? Option A, 304.
Option A, ma'am. Direct question. 34
For 14th one, you can directly eliminate option C and D. Okay.
Yes.
But in option B, 78 modifier is given.
78.
But why you didn't take the 78 modifier for B option? You took only A option, right?
78.
Unplanned return to the opportunity in the middle of the surgery, like that.
Yes. So here there is no any unplanned procedure. It's done
There
for
is
the
proper
patient.
planned procedure is happened.
Yes, it is a planned procedure. Option A is correct answer.
Awesome.
Yes, ma'am.
15th one.
A surgeon started with a diagnostic thoracoscopy during the same surgical session. She completed a surgical thoracoscopy to control a hemorrhagic. How should you report? Ma'am, I am giving option D, 32654.
Same.
Because
3 to 6.
Direct question right this one also.
Yes.
32654.
Surgical thoracoscopy to control hemorrhage. Option D is correct option. 2654.
Yes, ma'am. The control traumatic hemorrhage. For a diagnosis,
32654 code goes for
Thoracoscopy surgical.
thoracoscopy surgical with control traumatic hemorrhage.
Yes.
correct.
Yeah, to control
direct question.
hemorrhage. Yes, ma'am.
16.
Dr. Sakra performed CABG surgery on Fred 5 months ago. Today, Dr. Sakra completed another coronary artery bypass with using three venous graft with harvesting of a femoral popliteal vein segment. How would Dr. Sakra report her work for the current surgery? Option C.
C. 33
Ma'am,
512
I did not give in any answer, ma'am. Just randomly give B.
You didn't understand the question. 16th one.
Yes, ma'am, I did not understand. I'm just randomly put B, but it's wrong.
5 months ago, Dr. Sarah performed CABG surgery. And again,
Yes.
another CABG.
Another coronary artery bypass using the venous.
3 venous graft.
Yes.
3 venous graft.
Here 33512 and 33535 codes. You have to eliminate one of them. 33512 or 33535. Check this code description. 33512 and 33535.
The coronary artery bypass vein only. 3 coronary venous graft. That is 3514 description.
So Deepanjana, which one you will take?
Ma'am, I'm giving option B, but it's wrong, ma'am.
Option B.
Yeah, B for ball. 512 for coronary artery graft. Here is happened coronary artery graft bypass.
And 33530 for reoperation of CABG procedure.
3,
More than 1 month.
530.
1 second.
Reopen artery bypass procedure bypass more than 1. Three 519.
3351 9512 goes for
Sorry, ma'am.
33512 described.
33512 describe for
Coronary artery bypass.
three coronary venous graft.
CABG 3.
Okay, in this question, arterial graft is mentioned or vein graft is mentioned.
Vein graft. Venous graft.
Deepanjana,
Ma'am.
arterial graft is mentioned or vein graft is mentioned.
Yes,
In
ma'am.
this question, 16th question.
Yes, ma'am.
Which graft is mentioned?
A coronary artery bypass, ma'am. And using the 3 vein.
Vein segment. Femo
Yes, ma'am.
vein segment. It is not 33534.
Yes, ma'am. It is ma'am 335. Option C is the correct because ma'am
33512. Option C is correct.
512. Yes, ma'am.
Because doctor completed another procedure of CABG with harvesting of femoropopliteal vein segment. It's not arterial graft. Understood, Deepanjana?
Yes,
You have
yes,
to
ma'am.
take 33512, not 33534. 535, sorry.
Okay.
Then you can eliminate D and D option. And remaining A and C option is you have to analyze which one is correct.
C is the correct, ma'am.
51 modifier is multiple procedure. Here, multiple procedure is not done. Only single procedure. CABG. Right. So you can eliminate option A based on modifiers.
Yes, ma'am.
Understood,
So ma'am
Deepanjana?
can yes, ma'am.
Next question.
What is the primary codes 33880 and 33881 include? Option A. is there?
A, ma'am. A placement for all distal extension and if required the distal thoracic aorta for 381.
Option A is correct answer. Next move to
18th one.
question number 18 or 19.
18.
Yes, ma'am. 18, ma'am.
The patient is a 58-year-old white male, 1 month status post pneumonectomy. He had a post pneumonectomy emphysema treated with a tunneled pleural catheter with been draining the cavity for 1 month with clear drain. He has had no evidence of block or pleural fistula. Therefore, a planned return to surgery results in the removal of catheter. The correct CPD code is option D.
Option D.
32.
Okay.
Yes, ma'am. D. I'm go for my modifiers. So I did not check
Okay.
any code.
58 modifier describes
Stage and related procedure or service by the same physician or other qualified healthcare professional during the post-operative period. It may be necessary indicate the perform of procedure during the post-operative was planned anticipate.
yes, correct. Double three. You can analyze based on the code also.
Yes.
If
3
you
2
got confused based on the modifiers, you can analyze based on the codes.
Removal of indwelling tunnel pleural catheter with cuff.
Yeah. In this question, 1 month before post pneumonectomy is done and developed emphysema. Patient developed emphysema, and now he currently has tunneled catheter drainage removal. And also procedure is already planned for this removal of catheter. That's why they use 58 modifier. 58 modifier is for planned procedure, right?
Yes.
So last line. Last line or last question?
19th one.
1 second. So in 18th question, last line, all they mention, provider mentioned planned return to surgery result for the removal of catheter. So you have to use 58 modifier.
58 modifier. So in short note, like a planned procedure means 58 modifier.
58 modifiers. Did you understood?
Yes.
When you have to use 58 modifier?
For plan procedure.
Yes. When provider already planned for this procedure, you have to put 55 modifier, 58 modifier.
Okay.
Yes,
Sorry, 32552 codes describes as
Removal of indwelling tunneled pleural catheter with cuff.
32552 is for direct code. In second line, they mention tunnel coupled pleural catheter treated with tunnel coupled pleural catheter. For that procedure, they give a 32552. And 58 modifier is for planned surgery. Provider plan for this surgery long ago. That's why they may give a 58 modifier.
Okay.
Understood, right?
This one.
When you have to give 58 modifier and 26 modifier.
Okay.
ma'am. Can you differentiate? Means I did not get it. Please repeat.
58 modifier.
Yes, ma'am. And 26.
26.
26 modifier for
Professional
physician itself reviewing or interpreting the
lab report.
Lab reports without involving the lab technician. Okay.
Okay, ma'am. And ma'am, 58 for plan procedure, right?
Planned procedure. Like 1 week before only, provider plan for the procedure for the patient treatment.
Can you explain 59, ma'am? 59 modifier.
59. Distinct procedure service means two different procedure. Wait 1 second. I will read all this.
Moving to 19th question or 18th question you guys are staying in?
1 second. 1 second. 1 second.
Okay.
1 second, sir.
Yeah.
Okay. 59 modifier is two different procedure done in same day with different timeline. Okay. Like appendectomy and other biopsy, two different procedure done in same day. One morning and one afternoon.
By same physician.
By same physician.
Okay.
Two different procedure done in same day with same timeline. Okay.
Okay.
In that case, you have to give 59 modified. 16 procedure services.
Okay.
Ma'am, that same day different procedure, that for 59 modified.
Yes, yes.
And 58, ma'am?
58 is for, I already explained at the same.
Ma'am, that is I did not get it because due to network issue.
Post-op period, I think. 58.
58 is for planned.
Planned.
Already physician planned for the procedure. Okay.
Planned procedure.
1 week before only physician planned for the patient procedure. Understood? Deepanjana? Ramya?
Yes, ma'am.
Yes, ma'am. We'll move on.
Let's move to the other question, or you have any doubt for the modifier?
19.
Ma'am, I have another doubt in one modifier. Can you ask now or after?
Which one?
After the 33, ma'am.
33.
I'm confused, ma'am. How to use that?
3.
Preventive service.
Okay, I'll explain this one later. Okay, I have to read this preventive services.
Oh,
We'll finish that two questions,
okay.
19th and 20.
19. So the patient is a 77-year-old female, white female, who has been having a right temporal pain and headache with some visual changes and has a SED rate of 51. She is scheduled for a temporary artery biopsy to rule out temporal arteritis. A Doppler probe was used to isolate the temporal artery, and using a marking pen, the path of the artery was drawn. A lidocaine 1% was used to infiltrate the skin, and using 15-blade scalpel, the skin was opened in the preauricular area and dissected down to the subcutaneous tissue where the temporal artery was identified in its bed. It was a medium-sized artery, and we dissected it for about 4 centimeters with some branches. The ends were ligated with 4-0 vicryl, and the artery was removed from its bed and sent to pathology as specimen. What code should you use for this procedure? Option A, I am given.
Option A.
37609.
Deepanjana? Which one you gave? This one is direct question. Only one line is
Ligation or biopsy temporal artery.
yes. The female patient undergo procedure for temporal artery biopsy. Deepanjana? Hello?
So I'm giving also option A, ma'am. 37609. Temporal artery procedure.
Option A is correct answer. Because option B is for internal and external carotid artery, and option C for arterial catheterization. Option A is for ligation and biopsy temporal. Temporal biopsy or ligation. So option A is correct answer.
Correct.
one also direct question.
Yes, ma'am.
Next question, 20th.
Ma'am, 21 I don't understand, but I am randomly answer, but it's coming correct.
So 512.
Yes. Ramya?
Yes, ma'am. For me, also it is correct. C, option C.
Did you understand the question or you gave random?
No, I have understood.
I will tell once again.
Ah,
Here, female patient is undergo heart surgery that involving 3 coronary bypass along with the MACE procedure. Okay, to treat the heart rhythm issues or heart rate issues.
okay.
This is the condition of the female patient.
Okay.
The patient came for the heart surgery, they involving CABG and also with MACE procedure. Here, 2 procedure is done. One is CABG and another one is MACE procedure. So you have to give 51 modifier.
And also endoscopy.
Yeah, 33512 is code for coronary artery bypass graft using 3 coronary arteries.
3 coronary.
Directly leading right this code 33512.
Yes, ma'am.
Option A you can directly eliminate, and option A is directly eliminated. B, C, and D.
B, C,
You have
and D.
to analyze which one is.
Eliminate, ma'am. That is unlisted. Last option. That 33999 is unlisted, so we can eliminate that also.
Yes. B option also you can eliminate directly. Unlisted procedure.
Yes, ma'am.
C and D.
In C and D, modifier is the only one. Like for 335.
So you have to give 51 modifiers.
No, we have to give only one modifier.
One modifier, right?
Yes.
So you can eliminate option D also.
Also, okay.
Deepanjana? Hello?
Yes, ma'am. Yes, ma'am.
Did you understood? You can easily eliminate 3 options.
By ma'am, last one, ma'am. That last option.
Last one, 2 modifier is given, 51, 51. You can give only one modifier, right?
Yes,
One
ma'am.
time.
Yes, ma'am. So
33508 for endoscopic harvesting.
Yes, ma'am.
And 33254 for MACE procedure.
Yes, here is happened is the MACE procedure.
You can directly give 3. Sorry, C.
Option C.
Option C.
Procedure.
Finish that.
Yes, ma'am.
Yes, ma'am.
Any doubt?
No.
As of now, ma'am, no doubt. So, ma'am, like that 33 modifier, you keep another class or?
Okay, I'll ask sir. Okay.
Ma'am, can you just give me a hint for the modifiers? Like as you have said, planned procedure 58. You have anything? Hint like that?
Okay, 1 second, I'll ask sir.
Like keyword.
Okay, I'll ask.
Guys, what is the guys? Sorry to interrupt. Hello.
Yes, sir.
Yeah.
Yes, sir.
What is the answer for fourth one?
What?
A patient is underwent on a secondary peritoneous transluminal and tracheobectomy for revertal for B, right?
Option B.
B one 37186 in addition primary procedure.
And what is the answer for eighth one?
8-1. Option
Options B.
B.
193.
Okay. How is the classes is going on right now?
Going good, sir.
Going good. Okay. Any like I'm not seeing any particular thing like you are not asking in a questions in a group. Only Deepanjana will ask. Ramya ma'am, you are not asking any doubts or any like this thing. Why?
I will directly
Actually,
say.
Yes, yes.
actually, Jeevan, Ramya ma'am experience already work. I am recess in this field.
Huh? Still, okay. I think number three is okay. I'm already experienced. You are not experienced. It's not about the
Yes,
experience. It's about how you gonna guys learning the things actually.
yes, yes,
Okay. Because it's a different procedure, right?
yes,
The procedures are different. The pattern are different. Okay. It's nothing like way of understanding it, understanding the question. How will be you are implementing the doubts and other things. Okay. Yeah. Yeah. So
Hello.
we can take.
Okay, sir. Thank you. Hello, Deepanjana.
yes,
Ramya.
yes, ma'am.
Yes, ma'am.
If you're free in Saturday, I'll take modifier once again. Okay.
Okay, ma'am.
Every modifier.
Okay, ma'am.
Like,
Modifier plus, ma'am.
Yes.
like,
Every modifier I'll explain.
like keywords and easy to
And
remember.
keywords. Yeah, yeah, yeah. I'll give
Yes,
example
ma'am.
and keywords.
Actually, ma'am, I'm started making a note, so that's why I'm
Okay.
little bit
Little
Just now I
confused.
told 26 and 58. Sorry. I told 58 modified 20. Did you understood right?
That is
Once.
clear, ma'am. I have confusion between this 24 and
Yeah,
53.
I'll explain everything. Okay. In Saturday evening.
Okay.
yes, ma'am.
Okay.
Both
So,
of
ma'am,
you right?
Saturday you take another class,
I'll take modifier.
Okay, ma'am.
modifier class.
Yeah. Again, I'll take modified class.
Okay, ma'am. Thank you for.
Ramya, ma'am, where you moving in Dubai, ma'am? At which place? Like you are
Yes, in Dubai only, sir.
Dubai only you are moving, right? Okay.
Yes,
Because after completing, na, I need to look for a job profile also for you.
yes, yes.
Okay, that is the reason I'm asking.
Okay.
In Dubai, where, ma'am?
In Dubai, like nearby international city,
Nearby international city. Okay.
Dubai International City.
Okay, okay. Have you trying from your end or like I should help on this thing?
Yes, you have to help, sir. That's why I opted for your institution.
Okay, 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 okay. I will try,
Yeah.
ma'am. Because see, I have to look for right now only. Okay.
Yes, ma'am.
Anyhow,
You said that.
we have
Yeah.
like you are joined on the December. By this February, it need to be end by the end of the March actually. But it has taken some long time due to some uncertain other things actually from
Yes.
our end also from sometimes the two mega members are there like Sangeeta and Netra from their end. So that's the reason we have shifted them for another batch.
Okay.
Okay, we have to focus on two of you guys right now from here onwards.
Yes.
So kindly like go on this thing, and I'm sharing like from team you will be getting mock papers also.
Okay.
Kindly practice on that thing. Okay, because like if you practice more, na, you will get handy on the subject and you will get a handy on the concepts. Okay,
Okay.
so that is
Okay.
the reason. Yes, Dubai, right?
Yes, sir. Dubai.
Dubai, Dubai. Okay, okay, ma'am.
Jeevan, help me out in India only.
Definitely, yeah. You are seeing this post, na? Like I'm
Yes.
sharing in a group.
Yes. Yes.
Everyone asking like certification, Deepanjana.
Mm.
Okay, kindly like opt for that certification. Then I will like definitely we will help you. Okay, since Soundarya ma'am is there and Aditya sir is there. Okay, they are also working in the same company, Cora. Okay, and
Ma'am also working in Kora.
yes,
No, no, no.
no, you are not.
After
Okay, ma'am is
Optum.
Optum. Ma'am is Optum, and Aditya sir is in Cora.
Ma'am,
And
every day I
who are
got a
giving
link
it?
message.
what message?
Means this type of vacancy in mail incoming. This type of
Hmm.
vacancy is there like this.
Vacancy. Okay, okay.
Ma'am, where is Optum? Where it is in Bangalore?
Bangalore,
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 Hyderabad,
Hyderabad, Pune.
Chennai,
From which area, ma'am, in Bangalore?
MTP, Manyata Tech Park.
Oh, Manyata. Okay. It's nearby.
Ma'am, please refer me.
Definitely, definitely they will refer you guys. Okay, no worries. Definitely they will refer you. Okay, just focus on the exams pattern and just clear the exam. Our requirement is you need to clear the exam. That's all.
Okay.
Okay, so
Yes.
definitely we will help you on that thing. Okay, guys, and yeah, any doubts, any questions you left right now?
No.
No, as of now,
So
no, Jeevan.
Deepanjana and Ramya, any feedback? 1 minute. 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 1
For what, ma'am?
for today class?
Today class is good, ma'am.
Okay. What about
Understood, right?
Aditya sir class?
Nice also.
Okay, I will give a feedback to him then. Okay, okay, guys. Then
Thanks.
yeah,
Tell me honest review. Okay. We have
Ma'am, I'm giving honest review after my CPC exam.
okay, guys. Okay, and yes, if you have guys facing any doubts, any issues, means kindly reach out to me. Otherwise, kindly text it in a group. Okay, and we have support system also for you guys. If anything is there, means you can just tell us. And from next week onwards, the placements thing will gonna start. Okay, preparing about the
But
interviews.
even I can't apply now because we don't
No,
have
no.
a
This
certificate. So
mock interviews majorly.
Oh, interviews.
Okay.
mock interviews.
Yes. Play, this thing need to be start right. Corporate education training has done, right?
Yes.
Like interview preparation need to be done, right? As per the syllabus and as per the classes, this thing. Next week, no need to worry. From next week, interview preparations will be also done. Okay. And once you clear the CPC means then your resumes will be gonna with the ATS team, application tracking system team will be there. They will gonna take care of your resumes, and from there in they will start applying for different companies and different domains. Okay, so yeah, one thing is that Ramya ma'am's challenge, like this is very challenging for us right now. Okay, that is the reason
Okay.
I will be starting from tomorrow onwards only for you, ma'am. Okay.
Okay. Okay.
uh,
So thanks.
yeah, so like let's see, ma'am. Okay, because the starting package for in Dubai is majorly like is 3175 AD it will start majorly.
Okay.
Okay,
No
me
problem.
Per
No.
month,
per month
3,000.
3000 AD. Okay, it will start. It depend on the interview. I'm not telling. It's average salary. I'm telling you. Okay,
Okay. Okay.
depend on the educational background, depend on the experience, depend on the like how you'll crack the interview and how you'll negotiate with the HR people. It depends.
Oh.
Okay, that is the reason we are starting on that particular thing. Okay, yeah.
Actually, in Dubai, I have heard that
Mm.
any like reference, if we get reference means we can do in okay,
Yeah, without reference in Dubai it was not possible, ma'am.
reference.
Reference is
Mm,
needed, no worries.
everybody says like in everybody says yeah, reference is very important in Dubai.
Yes, yes. Without reference, it is possible, but still, I'm telling you, na, like we have to wait and we have to look for it. We have there are options are available. Okay.
Okay.
Huh?
Sir, one question for Soundari ma'am. Ma'am,
Yeah, Sundari, ma'am.
yes. Tell me.
ma'am, how is this AI contributing in coding, ma'am, nowadays? Artificial intelligence.
Like coding is based on manual. Okay, right now.
Okay.
AI also coding, but it's not 100%.
Okay.
They coding
So
like
our
families.
job is
Some we have to apply some guideline, right?
yes, ma'am.
For every chat, we have to apply some guideline, different guideline.
Okay.
Client guideline.
Mm-hmm. Yes.
So every week or every day, they're changing the guideline, client guideline.
So our job is safe, not that's why I'm asking because now this IT
Job is safe.
is coming
Because
down.
AI also coding, but manual is more important.
Majorly, the thing will be there, na. Like you'll be like for searching in a code. The sometimes what will happen in a CPT codings. Okay. So things to be need to be searched in a manual way, where you'll be using generative AIs like Gemini. We will be using. Okay. Generative AIs, Gen AIs like ChatGPT will be there. Okay. Some
AI
emergent.
is not applying any guideline, right?
Uh-huh. Yes, definitely. You are the decider here, right?
Yeah.
You need to look for that thing like for coding and
Client
other.
requirement.
Yes, Gen AI majorly not it not affecting. It is you have to use actually. Okay, AI is not right now. It was in 2014, I think so. When I was in this particular thing, it was 2014, I think so. Right now, they are using
To the
2014 in every field they are using. Actually, it came prominent in this after post COVID it came prominent. Okay, so that won't be an issue. You are the decider. You need to adapt that thing. You know how to use the Gemini, right? You know how to use the Chat GPT. Just putting a prompt over there. That's all. It will not take your job, guys. No worries. Okay. Uh,
Okay.
and it will useful or which is very much useful for you basically. Even see if I do something means I will use Chat GPT because I need to put up a prompt over there, right?
Yes. Yes.
See, if I need a something data or anything means I have to put a like insight what we call prompt majorly. Okay, if I need to go for like you have to build a app means we have to give a specifications, right? If I give the
Yes.
specification means then only it will understand the what I need, then it will make it and give for me. That's all.
Oh.
Okay, if I make to China Chat GPT, most of the people will do resumes in Chat GPT only. But I won't do. I have some different tools and other things. Okay.
And
Okay.
one
Huh.
more thing,
Yes, yes.
like for simple diagnosis, the provider will not get any amount. Okay, A will code everything like fever, cold, everything. But for that, there is no amount for the provider.
Okay.
We have to analyze which disease we have to code or which disease we have to skip.
Okay. Ma'am, you are in which specialty, ma'am?
ICD.
I see. Okay.
Yeah.
Okay.
How is
Ma'am,
ICT
ICT coding.
Hello.
It's ma'am, ICT coding.
Yeah, ICD coding.
It's very difficult for me. ICD coding.
It will be easy.
HCC, no, ma'am. HCC, they will say.
Yeah, HCC.
Okay.
One more thing, ma'am. Kindly download Ramya, ma'am.
Yes, ma'am. Yes, sir.
Naukri Gulf.
No.
Naukri.
Download, huh?
You have to
Now
download
people
that thing.
go right.
Okay. After that, downloading that particular thing and kindly share me the resume, whatever you have a resume right now, and kindly share me the that Naukri Gulf ID and password to me tomorrow.
Okay.
Okay.
But
Even I am also.
No, Deepanjana. No, Deepanjana. After completing the interviews and other thing, I will tell you. Okay. Yeah,
sir,
you,
Jeevan sir,
you can left. You can left somewhere, ma'am.
sir, Jeevan sir,
Thank you.
Yeah, ma'am. Tell me.
sir. Actually, my flights got booked. Like on March 18th, I'm flying to
Oh,
Dubai.
okay.
So before that, I cannot do my CPC, no, or if I don't know whether here I can do or there I can do. You just give me the suggestion where where I
Ma'am, you
can do
can
my
do it there
CPC.
only because see, ma'am, it's not a like we have to complete the syllabus kind that is not is the here. Okay, we will give up 10, 15 mock papers, final.
Okay.
Okay, after
Okay.
completing all these things, it's taking some time. Why? Because we are focusing on you guys. Okay,
Okay.
that is the reason we have removed these two people and put it in like today we have decided. Okay, today also they
Okay.
didn't attend the classes, right?
Ah.
Then it
Yes.
will it is not our fault also, right? Because of
Yes.
them it is delaying actually. So that is the reason we are not focusing on this. Okay, we have to complete the syllabus. It is a syllabus. We have to now nothing like that. Okay, we are mainly focusing on the student side here. Okay.
Actually, I want to appreciate for you because for two people you are taking class. That is very big
No,
thing.
ma'am, it's nothing like that. It's okay. Because we are mainly on the ma'am. We need a result, ma'am. I already told you first day. Okay.
Yes.
We need a result. That is the reason. Whatever we for that thing, whatever we have to do, we have taken this thing. Okay.
Okay.
So two people means you are also like came for study only, right? It's
Yes.
our
Yes.
duty to teach you here.
Yes.
Okay. Yeah, that's what I'm trying to say is here like no need to worry. You can write it in Dubai also. You can write it in UK also. You can write it in wherever you want. Okay, that won't matter here. Matter is here at the end of the end of the training. At the end of the like once you completing 90 or 95% of your training, we'll provide a 15 mock papers for you guys for both of you.
Okay.
Okay. Huh? Yes, you can write it
Okay.
from Kolkata also, Deepanjana. It's fine. Okay, there is a like I think in Howrah there is a this one is there which we call say exam center is there. You can write it over from there also. Okay.
Yeah, that's good.
Okay. In 15 mock papers, you have to clear 5 mock papers with a percentage of 95.
Okay.
And
Okay. So how much? With a percentage of 95. Okay. then only you will be eligible for write the live exam. Got it, Deepanjana?
Okay.
Got it,
Ah,
Jeevan.
okay, then only you
Just
guys.
help me.
I will help you guys. I will help you definitely from my end. Whatever you require, we will help you. Okay. So then only you guys are eligible for the writing the final exam. If you're not able to go with the, you're not able to clear the 5 mock papers also. No, again you will be going for a training here.
Okay.
Okay. You no need to pay. You no need to do anything. Okay. Just you need to practice, practice, practice. Okay.
Okay, Jeevan.
Ah.
Hey, in Dubai, you told like 3,000 AD
Hmm.
for the starting per month. In India,
Is
how
dip
much?
AD means you have to convert actually.
Yeah, in convert, but in Dubai, this that is I'm not going for. But in India, how
70
much this?
3000 AD means 74 79,000 something it come.
I think six, like 70,000.
70 74 or 75,000 it will come. Okay. In Indian rupee 24 rupees. 1 rupees means United Arab Emirates 24. Okay. That's what, like you can easily start, no need to worry. Okay, because ma'am is settling over there means that is the reason she will be going for Dubai, nothing else, Deepanjana. Okay. Huh?
Husband already moved.
Even you don't say like in India how much they pay.
In India 30 to 35,000 as a starting package, nothing like we can't provide you like I'm not promising you over 50,000 60,000 over here. Okay, it depends like which country,
Possible.
like yes, 30 35,000 you can easily get it, guys. Okay, once you gain 1.5 year or 2 years experience means definitely like it will be like you will be getting around 50 plus, I'm telling you. Okay, since Ramya ma'am also from billing background and Deepanjana is also from billing background, you can easily move on this particular role, guys.
You can
Easily move to this particular round and you can easily grab the opportunities. Okay. Okay, ma'am. I have taken a lot of time of you.
Thank you.
Yeah, thank you and have a great day. And tomorrow, ma'am, kindly do like ask you some this thing. Kindly do that thing, ma'am, from tomorrow. Okay. I need a resume.
Resume. Okay.
Resume, ma'am, and Naukri Gulf you need to download.
Uh,
Which one, ma'am?
okay. Naukri Gulf.
Naukri Gulf. Okay.
And I
You
have
need,
to log in and
uh,
from here I can log in and do the thing.
give yes, login and give like give it the password and login ID. Okay, then I
Okay.
will do some changes from here onwards according to your resume and other things. Okay,
Okay.
from
Okay.
here only you can apply over there. Okay,
Okay.
one more catch is there. I think DHA exam you need to write over there. Okay,
I think
I will clarify, I will clarify from the particular person. Okay,
okay.
is like is a DHA exam is needed or CPC is enough? Okay, I think CPC is enough actually. Okay.
Yeah, even I also.
I don't think so. DHA is required. If some 80% DHA is not needed.
Okay.
20% I need to get a clarification on this particular
Okay.
thing. Even I don't have a clarification on this thing. Once I
Yes.
clarify, like if I get a clarification, means I will tell you is needed or not. Okay.
Okay, so I will download and I will share you the password, login password and my resume.
Okay, ma'am. Okay. I need
So
a one
I can,
photo also. Passport size
sir,
photo.
passport is.
Passport size photo. Like for a profile pic actually.
Okay.
Okay, if you have means you can upload a professional pic is needed. Okay,
Professional. Okay.
professional. Like if you not having a professional photo means no worries. We will generate from AI. Okay.
Okay. Okay.
Okay, ma'am.
Bye.
Thank you.
Thank you, sir.
Thank you, Deepanjana. Thank you, Ramya.
Bye, Jeevan. Good night.
Good night. Good night. Good night. ನೋಡಿ ಹಿಂಗೆ